My name is Dr. Kelvin Julius Msuya. I'm a gynecologist working at St. Thomas Health Center, Arusha. I have benefited from the training program of Merck More Than a Mother, which I had a training in advanced hands-on in clinical embryology, which was done in Bangalore at a center which is called BACC, Bangalore Assisted Conception Center. And I completed my course of clinical embryology in the year 2017. The program of hands-on clinical embryology was a very useful one. We had a thorough hands-on training. We were attached to very experienced personnel at the center. We had good exposure. We had exposure in andrology. We had exposure in embryology lab. We had a chance to move around different centers which were experienced in working with infertility and generally in assisted conception. So the embryology lab was very well equipped. The teachers were experienced, and we got to do most of the work and had a truly hands-on experience. So we got to do all the work which will be done by an embryologist, which included gametes manipulation and including fertilization, IVF, ICSI, which is intracytoplasmic sperm injection, and even embryo freezing, to mention a few. And also a very good exposure in andrology lab. And also we got an advantage of getting an online course on IRSI from a certificate of American Society of Reproductive Medicine. So it was a really well organized program, a really good staff, really good exposure and experienced, and it was very educative. The program has really equipped me with skills to run the lab, IVF center. So at St. Thomas Health Center, we have an IVF facility. There are very few IVF facilities in the country, although the number is increasing gradually. So with the patients we've been receiving, I've been able to work with them and work with other colleagues in the field of fertility or IVF, and really it has really helped me. So we have an embryology lab which is really performing better. We have increased number of patients which we are seeing now, and we have a good number of pregnancy outcomes. So I would like generally to say it has made me grow in my career, in my profession, and generally the hospital, the center, and I can even mention maybe the entire area or region. And we are helping more mothers who are having challenges in getting babies, or let's say families in general which are having challenges. So career-wise, and it has really been a useful experience and knowledge from the Merck program of More Than a Mother. Everyone who is interested in the field of fertility and assisted reproductive technology, I would recommend them to attend to the Merck More Than a Mother program, which facilitates learning in the field, and that has personally helped me a lot. So I think it will be a very good experience to every other person in the field, and it will help them to give better care to their patients, better understanding of the problems they face, and also help them get better outcomes in the field, in their personal careers, and also to the patients who will have better outcomes of treatment. The exposure which I received from the program, the hands-on program of Merck More Than a Mother, and the hands-on program in the clinical embryology, is actually, I think, amongst the very first people to to be trained from my country. And I really like to thank Merck for selecting me, of course, alongside with my other few colleagues, which we train together. That has really helped my career, has really helped my practice, and Merck has been a very vital part in helping me. So I would generally appreciate, I appreciate greatly the help which Merck has offered me in training me in this category, this field.